Hello, my name is Dr. Zulkarnain Ahmed. I'm a GP partner, trainer, and a coach and host of GP Pod. In this video, we're going to be talking about 8 different websites which every GP trainee needs to know. All these websites are very helpful, very useful, and I'm sure some of them you'll not even have heard of. So sit down, relax, get a cup of coffee, and let's get cracking. My aim is to help young doctors succeed in primary care and hopefully empower them and retain them in general practice. Let me jump on my iPad so that I can show you the websites. So the first website which we're going to talk about is the GP Notebook. This is a really good website. It gives you a lot of background information with regards to how the patient present in general practice and what things you should be looking out for, how you should manage them. And the good thing about this is that you can look at various different topics and things. It does ask you to sign in with your NHS account. However, I think it does work with your trust account as well if you're not working in general practice. So, for example, if you were to look at one topic, let's say gout, it tells you about the signs and symptoms and treatment and acute flare-up. So this is quite good. And it also talks about the long-term management and what other things you need to be thinking about, including CKD and how you would manage that. So that is one of the websites. Next website is NICE CKS. Some of you would have heard about the NICE guidance, which is one of the gold standard guidance which we follow here in UK. But the problem with the NICE guidance is it's quite long and you have to go through different pages and pages and pages for you to look at before you know what you need to do in terms of a particular patient who sat in front of you. So I quite like the NICE CKS website because CKS stands for Clinical Knowledge Summaries. For example, we can look for any topic. Let's say we look at migraine, for example. So what it does is it gives you how to diagnose, what sort of assessment are you looking at. So it takes you to headache assessment. So it gives you all the common sort of different backgrounds, primary headaches, secondary headaches, how are they classified, and then so it gives you a kind of summary and you can go back and forth. So if you go to diagnosis, it can also gives you a treatment plan as well and what things you should be looking out for. So for example, any associated symptoms such as aura, nausea, vomiting, any other clinical symptoms, what you should be looking at in terms of the examination, fundoscopy, neurological examination, what red flags, for example, it talks about new, severe, or unexpected headache, progressive, other features. So, and then it talks about the migraine without aura and with aura, tension type headache, cluster headache. So give you all the differentials. So it does talk about the management side of things. I think there's a bit where it talks about the medication as well, which I think I may have missed previously. Red flags, but you get the idea. So that is another good website for you to look at. The third website which I'm going to is the BNF, the actual BNF. Some people may have seen the BNF, the British National Formulary, in the form of books, either in the general practice if they're working in general practice or in hospital. However, you can access this online. Again, very useful website. So if we look at, let's say, any medication, so we got the methotrexate here. It talks about all the indication, and what you would use. You don't particularly need to log into anything. You can just access it like this. So let's say if we look at some common medication, like methotrexate, let's say we look at Ramipril. So it talks about the indication. So if you've got patients sat in front of you, you don't know which medication to use and what dosage it is, so you can just open that up. And depending upon what you think the indication is, you can just sort of do the medication. It also talks about the renal impairment. So if somebody's got renal impairment and you need to adjust the dose, it talks about that and everything else and all the rest of it as well. It's also got the sister website, which is BNFC, which is the BNF for children. Again, really good website, and it works in a similar fashion as compared to the other one as well. But obviously it gives you the dosage in which are required for the children. So let's say if you look at dexamethasone for croup, for example, so local treatment of inflammation, no, mild group, yeah. So it tells us that 150 mics per kilos is the dose for group, or mild group. So we can just do it from there. So these are the two, again, very good, useful websites. Then the next one is called the Pediatrics for Primary Care. So this is a very useful website. So if you are a GP trainee and you're working in pediatrics, or if you're a GP trainee and you're working in general practice, in both scenarios, this is quite a helpful website. It talks about all the common conditions which may present to us as GPs, and it's got the list on the side here. So let's look at asthma, for example. So it talks about NICE guidance. It talks about all the other things which we should be thinking about. And here, which I find quite helpful, that in the middle it gives you a table as well. They're all usually sort of all the current guidance is there as well. It does give us a good sort of grounding into what we should be thinking about. So that's another really good website. If you've not seen this before, I definitely recommend it. So if you're a GP trainee and you're working in gynae and obstetrics, so this is a really good and useful website called BUMPS. So it tells us about all the medication which can be safely used in pregnancy, although you can look up in the BNF as well, but BNF isn't that much detailed, and sometimes you need a bit of a nuanced answer. So let's say fluoxetine in pregnancy. So we've got a patient who's got depression and we need to use fluoxetine. Yeah, so here it talks about the benefit. Obviously, it can help with the mental health side of things, but the good thing about this is this is what I really like. So it talks about the risk during pregnancy. So SSRIs are commonly taken during pregnancy without any problem. However, some studies have linked SSRI to a high chance of preterm delivery, have a baby with a low birth weight, all the rest of it. So I think in certain other cases it does talk about some other risks. So for example, some studies have suggested that up to 3 out of 100 children born to women taking an SSRI may develop autistic spectrum disorder. So these are some useful numbers to look at, and then it talks about the alternative as well. So I'm pretty sure most people, and most trainees at least, would not have heard about this. So if you're liking the video so far, if you're still watching, please give us a thumbs up. And please share it with at least 2 friends who you think might benefit from it. So the next website we're going to be looking at is called DermNZ or DermNet. So DermNet is quite a good website if you're working in general practice, or if you're doing a GP plus dermatology post. Again, it gives you kind of a pictorial representation as well. So let's see if we look at acne rosacea. So it talks about the acne, gives you different pictures and things where you can compare, and sometimes I bring it up in front of our patients and I show it to my patients as well, and then they can agree or disagree, or they might have certain questions. So it talks about signs and symptoms, what to look out for, and it's got really useful pictures, and it talks about the treatment as well at the end and what other things you need to be thinking about. Treatment here, lifestyle, cleansers, physical sunscreens, and all of that. So that's another good website. Now the last 2 websites are more generic. They're more for the patients, but you as a trainee need to be aware of that, because patients will often go on internet and look at these websites. And the NHS website is for various conditions and things. Say we look at, what do we look at? Acute cholecystitis. So it talks about the signs and symptoms, what to look out for, when to go and see a GP. This is quite a good website to signpost patients to, if we're safety netting, or if we're asking them what to look out for. So this is quite a useful website for that. Another one which is similar and which I use often is patient.co.uk. I often use it with my patients. Sometimes I would print things, and you can print leaflets of various medication. Let's say we look at nut allergy. So it talks about various different nut allergies, how it might happen, what else you need to see. We look at certain condition as well, a particular specific condition, let's say anemia. So it talks about the types of anemia, thalassemia, sickle cell anemia, and what other factors. Yeah, again, very useful website to look at and signpost patients to. So these are the 8 different websites which you can use. So let me know in the comments below how you found this video, and would you like me to make any of those videos in future. And I'll see you in the next video. Up until then, bye bye.